Hello and welcome back to the third and final video. We'll be discussing the conservative management of TMJD. So let's get right into it. Basically, the management options available to us physiotherapists is patient education, dry needling, modalities, oral splints, joint mobilization, soft tissue mobilization, friction massage, therapeutic exercises, and cervical spine management. I believe the main one for us that I've placed the most emphasis on is patient education. So addressing their parafunctional habits, such as not chewing their nails or biting on their nails or chewing on pens or pencils. Also, under this, if you remember back to our video, we discussed parafunctional habits being as playing musical instruments as well. So trying to ease out on those habits so you allow for your joint to normalize again. Another main thing is education on food. So food consistency plays a big role because harder, drier foods generally take a lot more of chewing cycles, and so again placing increased load on the TMJ joint, which is not required if you're trying to heal and recover. So in terms of diet modifications, tell them to use softer foods, eat them for weeks to months depending on how their symptoms progress. Um, for patients with hypermobility, what you want to do is tell them if to avoid opening their mouth excessively at end range positions. So for example, taking a big bite into an apple, something that you want to keep away from. In terms of good tip for them, what you can tell them is when they open their mouth, try not to open their mouth past the point where the tip of the tongue cannot touch the roof of the roof of the mouth. So always in contact. So that way you don't allow them to overly excessively open their mouth. So essentially tell them not to open their mouth fully until full range of motion has been regained. Improve posture by obtaining axial extension. So good posture, we'll be discussing this later. It's very, very important, and some of the exercise that we'll be doing later as well, incorporate that too. In terms of balancing chewing from left to right, so don't just chew on one side, balance it out. Simple things, easy and effective. Modify activities as needed, such as resting your chin on your hand, phone use, even sleeping with a hand on the side of your face. And last thing is education on terms of stress and anxiety. A lot of people carry a lot of stress in here, especially the upper cervical and neck musculature as well. And generally, deep breathing exercises, as you all know, are very, very effective. Tell them to do yoga, reduce that stress and anxiety, and will help a long way. In terms of therapeutic interventions, IFC Intense is the first time we're going to be talking about. Basically, for this, electrical stimulation to patients with acute or chronic pain provided significant short-term decrease in symptoms, but also helped not just with pain, but also range of motion as well. So, I mean, use it, and if it provides benefit to your patient, all for it. In terms of biofeedback, usually recommended for patients who are presenting with like altered muscular activation. So basically place the pads on which muscle you feel is affected, and basically it's done to retrain and relax the muscles. So that would be really effective as well. An amazing adjunct to any therapeutic intervention is providing heat, moist heat over the TMJ to induce relaxation, reduce pain, and promote increased blood flow to the area. Generally, it's people find it very relaxing as well, so it helps with the anxiety and stress factor as well. The last one is dry needling. Unfortunately, I don't know how to do dry needling as right now, but it will be very useful once we do have that practical skill. So I won't be able to show you how to do it, but if you have it, do some dry needling for the muscles that present with trigger points that you will feel when you've completed your assessment. Alright. Now in terms of oral splints, generally they're worn during sleep to protect the teeth from like wearing and tearing, which is called nocturnal bruxism, or to reduce TMJD symptoms. So essentially it's a 2-in-1, and they're trying to essentially return the disc back into its resting position by easing muscle tension and stabilizing the jaw. How it does that is by the oral splint essentially is like it promotes the normal resting position of the jaw, and normally your jaw does not basically is not teeth on teeth whenever you are not talking. There's a little bit of gap in between, and if you don't have that gap, over time it can cause you to experience those TMJ symptoms. So using the oral splints can be beneficial, although the evidence for it is is kind of mixed. So, there's no harm done. So feel free to use it as well. In terms of joint mobilizations, what I've done for you is made a video, which I will be playing right now. So sit back and enjoy the video. Okay, so joint mobs. Joint mobs are essential to physiotherapy and work well in treating a variety of dysfunctions. They allow for inhibition of pain, increase the range of motion, and they also help inhibit muscle spasms. They also down-modulate the central sensitization as well. The only point at which they should be avoided is if the patient has any hypermobility in the TMJ itself. So we'll be doing 4 movements: distraction, anterior glide, medial, lateral glide, and can glide, which is caudal, anterior, medial. These can be done in various mouth openings or active ranges of motion of the jaw. Alright, so let's get started. First one is distraction. So essentially, we'll be placing one hand over the top, and the index finger will be placed over the TMJ itself to feel for any movement within the joint. This is to brace. You will ask the patient to open their mouth. You're going to place your 5th digit on the same side, ipsilateral side, bottom molars. So please open your mouth. Good, like so. Good. And then you'll be holding on, and we will apply distraction force, which will be in downward motion. So just relax for me. Good. Down. So you want to ask the patient how they are feeling the whole time, if they're feeling any pain or discomfort. Good. That was your distraction. Now, same position for anterior glides. So one hand stabilizing, index finger over the TMJ to feel for movement and see what's going on within the joint. And then the testing hand will place 5th digit on the bottom molars of the mandible on the same side that is being tested. And then you'll be grabbing on and pulling in an anterior glide, so bringing it forward. Alright, just relax. Good. Good. Alright, that is your anterior glide. Now for the medial glide, I will take off my gloves. And essentially the medial glide is done by one hand will be stabilizing the contralateral side. So I will be placing this hand on the zygomatic arch, and just there to purely counteract the force that I will be applying. And for the medial lateral glide, which I'm going to do now, the other hand, the testing hand, is placed on the affected side, and you will be placing it on the mandibular condyle, like so. So you can have a feel. Good. And then you'll be applying a medial force that direction. So just relax, ask the patient to relax, and apply a medial direction force. Good. So this force is going across. Alright. The 4th one is called the can glide, which is caudal anterior medial glide. So as the name suggests, the contralateral side is just to stabilize against the zygomatic arch, and then the other testing side of the TMJ, you will be placing a caudal anterior medial glide. So get behind, and you will place the force through the mandibular condyle or the ramus of the mandible, like so. So a caudal anterior medial glide. Just relax. Good. So essentially it's going down in that direction, coming across and down. Very good. Now, as I mentioned before, these can be done in various degrees of mouth opening or ranges of motion, wherever you feel there's any stiffness of any sort, as well as pain and muscle spasm in this specific range. Now, the dosage of this is dependent on patient's irritability, severity of impairments, patient's response rate, and chronicity of symptom presentation. So, take that all into consideration when giving joint mobilization to a patient with TMJD. Alright, another aspect to keep in mind is when you do the joint mobilization, the grade also depends on what you find in the objective assessment. So if you're addressing pain, or if you're addressing joint stiffness, your grade will go accordingly. Alright, Next one we'll be talking about is the soft tissue mobilizations. So I will have created another video for you which you will watch, and basically is to show you how to access some of the tricky muscles such as the medial and lateral pterygoid, which just go intraorally. Unfortunately, because of the close knit area of the mouth, I can't get a camera within the patient's mouth, so you're gonna have to bear with me. Here you go. So soft tissue mobilizations, what we're going to be doing is focusing on the muscles of the temporalis, the masseter, the medial and the lateral pterygoid muscles, which are accessed from the inside, and then we can also focus on the digastric muscle, releasing it, which are the bottom depressor muscles, and at the same time we can release the suboccipital and the muscles of the neck like scalenes and the SEM muscles, which are very important, as we said, because of their positioning of and their effect on the forward head posture. So we want to make sure we fix up their alignment. So we'll start off with the temporalis muscle. Again, like I mentioned before in the previous video, when we were doing our objective assessment, you can either use one finger, a reinforced, or 3 fingers to release these muscles. So just start off, make sure you cover all the fibers of the muscle. For example, the temporalis, it goes from the top to the bottom, general motion down, good. And from the back behind the ear too. As you can see, it's very soothing for the patient as well, but it can be painful at the same time when you feel the trigger points that you want to focus on, and you can focus on it on there. Next muscle you want to focus on is the masseter, just like we did before. So bring it from the angle, you can bring up, or you can go down towards the heart. Just like so. Does that feel okay? Good. So that's for your masseter muscle. Now for the medial and lateral pterygoids, you can go inside with your change of your gloves. And what we're going to do is open up your mouth, and we'll use again the pinky. And for the medial pterygoid muscle, you go down, just relax, and release this muscle right at the back and start in a scooping manner, trying to release that muscle. It's usually going to be very painful for people with TMJ. And the lateral pterygoid muscle is even going to be more and more painful. Good. You can do this until you feel a difference in between what it was before, and the muscle starts to give way. Now for the medial pterygoid muscle, you're going to ask the patient, you're going to open up their mouth. You're going to use your pinky. Now you're going to go along the top row, go all the way to the back, and then open up your mouth a little bit more. Good. And then you're going to ask the patient to close their mouth. Good. Right when they close, you can see he's wincing a little bit. The medial pterygoid muscle, the lateral pterygoid muscle pushes down on the finger, and you can use that mechanic to just slowly release that muscle. Good. Relax. Good. Very nice. Okay. That's your medial and lateral pterygoid muscles. Now at the same time, what you can do is also work on mobilizing the suboccipital muscles. So from the back, go in and release those muscles. Good. Because of the forward head posture, as I mentioned before. Good. As well as the SEM, so you can turn to the side. Usually going to be very, very tender. Small motion like so. Because of the forward head posture, it can be very sensitive as well. And of course, do the same thing on the other side as well. And then, once you're done that, you will be pretty good to go. Alright, so that was your soft tissue management. Instead of, now the next option available is, for management is frictioning massage. So it's been shown to be very beneficial at the symptoms coming in the area of lateral joint line, retrodiscal space, as well as temporalis insertion on the coronoid process, and myofascial trigger points on the temporalis. So frictioning massage essentially is like the transverse movement. It's like a movement. It's like um, it's to normalize the mobility by broadening, but not stretching or tearing the healing fibers. So it goes against the fibers, like perpendicular to them, not parallel to them. And it basically encourages realignment and lengthening of these fibers as well. So it's been shown to be very beneficial to use at these points. Alright, so next one is your therapeutic exercises. Therapeutic exercises, I have created a video for you discussing the Rockaboto exercise. So bear with me as I turn them on for you. Alright, so the therapeutic exercise, what we're going to be doing is the Rockaboto 6x6 program. Essentially is 6 exercises done 6 times per day, and is intended to reduce the excessive activity in the muscles of mastication. So what you want to start off with is fixing up the posture of your patient. So I want you to sit up nice and tall, bring your shoulders back a little bit, tuck your chin in, sitting up nice. Good. Alright, so first exercise is basically the resting tongue breathing. Okay, so placing your tip of your tongue on the roof of your mouth just before the teeth, and I want you to take nice 6 deep breaths from it. Good. We're going to assume he's done 6 breaths and move on to the next exercise, which is control of the TMJ. Essentially is keeping the tip of your tongue on the roof of your mouth just before the teeth, just like before, and then you're going to open your mouth without the tip of the tongue leaving the roof. Good. And you're going to do a nice and slow manner. Good. And we will do that for 6 times. Next exercise is rhythmic stabilization, essentially isometric exercises, and which are there to basically promote muscular relaxation by the reciprocal inhibition, which promote an improved jaw resting position through proprioceptive input. So essentially what we're going to be doing is, what I want you to do, grab 2 thumbs like this, place them under your jaw. Now without actually opening up your mouth, I want you to push into your fingers. Good. And I want you to do that 6 times. Good. Now what I want you to do is place your hand on the side against your jaw, and I want you to push your jaw into the hand. And we do that 6 times, and we do it on the other side as well. Other side. Good. Nice and slow. Alright, we're going to assume he's done 6. The next one is, I want you to clench your teeth together 6 times. Good. Alright, so we're going to assume he's done 6, and we'll move on to the next exercise, which is essentially axial extension of the neck. Another way of putting it, chin tucks. So what I want you to do, sitting up nice and tall, I want you to perform some chin tucks just like this. Nice and slow, 6 times. We're going to assume he's done chin tucks and 6 times and move on to the next one, which is your shoulder posture. Essentially it's just a posture correction where you're going to take your shoulders and you're going to retract and depress. So, like this, back and down, back and down. We're going to do that 6 times. Very good. Alright, and the last exercise is stabilized head flexion. Essentially you're going to wrap your fingers around the back of your neck from C2 to C7, and then you're going to perform a little chin tuck and bend down. Good. Bend your head forward. And we're going to do that 6 times. Very nice. Good. And we're going to assume he's done 6, and those are your Rockaboto exercise programs, 6x6. Alright, so that was your therapeutic exercises, the Rockaboto 6x6 program. These exercises are really good because they focus on both strength, stretching, as well as postural alignment for the TMJ and cervical spine. So it kind of hits all the marks, and they're really, really easy and straightforward to understand. Next we'll be talking about the cervical spine management. Like I said before, TMJD almost like 70% of the time is associated. You can, if a person has TMJD, most of the time they will have some sort of cervical dysfunction, such as forward head posture. So head protrusion usually causes, like I said in the observational video, um, the forward head posture causes mandible retrusion because of the muscles pulling back and causing stress on the TMJ. So impairments identified during like cervical spine examination should be addressed with appropriate interventions. So things you want to focus on is like um, try and get the patient's cervical range of motion full within their normal limits, um, as well as work on accessory movement restrictions wherever you find any restrictions. And the main one is altered muscle recruitment patterns. That's a really big one because usually people with forward head posture will present with over excitability of these global muscles. All right, so we've already learned about how to manage those within our course, so I'm pretty confident you guys can do that. Now, variability between research does not assist us in terms of clinical decision making, because like it doesn't tell us which intervention is more effective or worse than the other. But overall, research indicates that it's a multimodal approach is most beneficial, so that one that incorporates multiple aspects in treating TMJD. So keep that in mind. Don't focus just on one thing. There are various options available in terms of conservative management that can help you help the patient get better. Here is a great table summarized by a systematic review done by McNally et al. In 2006, where they discussed the interventions such as exercise postural training and their effects on TMJ therapeutic, their effects on TMJD. And basically all of these exercises and interventions showed positive benefit in some sort of way, either in terms of pain reduction or range of motion improvement, or even any reduced muscular dysfunction. So it goes to show, just like I said before, a little bit of everything will make a big difference, even if one doesn't do too much on itself. So be open, be creative, incorporate a lot of things. This study uses what they used was to find out the study strength. They used a scale, and here's the scale incorporated. It's a really good study. You guys should check it out definitely later on. And that summarizes us for the conservative management aspect for us physiotherapists in terms of what we can do for TMJD. I hope this was very informative for you guys and help you in the upcoming future as working as physiotherapists. Take care. Bye.